When Kerwin started skincare oncology, skin cancer was not on my radar at all. Hadn't had a skin check my whole life. Thought I was, pretty careful as an adult with sun protection and limiting my sun exposure. And so when that call came back, that I actually had 2 lesions that had come back as positive for basal cell, I was like completely shocked. Devastated actually, because so many things start swirling in your head. Just first of all, I have cancer and thinking about that, and then just what is treatment gonna look like and what am I gonna look like, and it's on my face, and there's just a lot of emotion that goes with that diagnosis.
Skin cancer is the most common human cancer, and specifically non-melanoma skin cancers are very common. I am seeing a rise in the patients that are coming here because also they are more aware.
When we created Skincare Oncology, it really was created to be all about the patient. But I tell you, it really strikes home when it becomes very personal and it's one of your family members now that has been diagnosed with skin cancer.
It was front and center. It was right on my forehead, 2 very prominent spots. I had the call back from the office, and they told me that we recommend Mohs surgery for this, and I remember asking on the phone call, well, are there other options? Are you going to tell me about any other options, because I really am fearful of being cut on since it's on my face and how that's going to look. And I distinctly remember the comment that came back was, well, we don't offer other options here, so we're going to schedule you for Mohs surgery. I was blessed to know about ig-srt, and I actually brought that up to them, and they reiterated their statement, well, we don't offer that option here, so we're going to schedule you for Mohs. Honestly, it made me quite angry that I wasn't being given options.
It's never easy for a patient to request options and, even to contradict a physician. It's not easy for them to do that. Very proud of Lisa in the fact that because of the knowledge that she had, because of our business, she was able to ask the right questions and transition to a different practice where she was able to get ig-srt, image-guided superficial radiation therapy.
Image-Guided SRT is a game changer, truly. It has impressed me because I have seen the outcomes. You can visually see that the patient has been cured of this skin cancer.
I did choose to go with ig-srt for the treatment of the 2 spots of basal cell on my forehead. What drove me to that was both of the spots were in very prominent parts of my forehead that would involve some significant cutting. Reconstruction is going to be necessary probably. And so with knowing what I knew about ig-srt, it became a pretty obvious choice for me that this was the route I wanted to take.
The benefits to the patients, specifically cosmetic benefits, is that there is no cut, there is no knife, there is no scar, there are no stitches, there are no track marks. There's no reminder that they had that skin cancer.
And the outcome was fantastic. No surgical scarring for sure, and very little issues at all. In January 2023, I was diagnosed again with basal cell, and now see a wonderful physician, Dr. Aga, who, because she offers both ig-srt and is a Mohs surgeon, she was able to offer me the option of having an ultrasound image done of it.
The GentleCure technology was instrumental in guiding us on the best treatment option for her. We used the imaging technology to determine the depth and the width of the tumor, and that helps us determine that Mohs surgery is the better option in this case. So in Lisa's case, essentially what we did is image-informed Mohs surgery.
She was able to tell me and actually draw on my face exactly where the incision would be if we decided to go the Mohs route, and exactly how it would look and how she intended to close it, and it was a completely different story than the first time around.
It was that image informing the cuts that would be required that allowed Lisa to make an informed decision about, do I want Mohs surgery in this instance, or do I want the radiation therapy? And it makes me really proud to know that she's now had both and she's happy with both.
I'm sharing my story today not to advocate just for one particular treatment modality for skin cancer, but I'm sharing my story because it's incredibly important to me that patients are given options, that all patients have options, that they're educated about these options and realize that they can be empowered to make the choice that's best for them. The second part of that, though, is that this option needs to be available to them, and so it's incredibly important that this modality is in a community near them, that it's readily available, and that they are able to access it.
I am proud to have GentleCure here. I'm proud to associate my practice and this reputation with this reputation for GentleCure, because we want to be innovative, we want to be at the forefront of medicine, and this has truly elevated the care of non-melanoma skin cancer.